Hi, this is Dr. Delaney, and today we're talking about FaceTite. We often have patients who have early facial soft tissue laxity and aging changes who are looking for an improvement, but they don't quite need a facelift just yet. Rather than telling these patients to come back in 5 or 10 years, we're happy to offer FaceTite radiofrequency treatment. With the FaceTite device, we could deliver thermal energy under the skin. Access to the lower face and neck is provided through tiny incisions under the chin and earlobes, therefore large unsightly scars are avoided with this treatment. This procedure is also the perfect complement to chin liposuction, which is commonly performed at the same time. The heat generated around the cannula tip leads to contraction of dermal collagen and fibrous septae and melts the fat, which together results in immediate contouring that continues to improve over the next 6 months. The treatment areas of the face and neck are first marked. The jowls and the borders of the jaw are outlined. The entry points to the marginal mandibular nerve are marked to avoid delivering too much energy to these nerves. The entry points for the cannula are then numbed using injection of a small amount of local anesthetics. In this patient's case, she had an old scar under the chin that we were excising at the same time. Small, tiny stab incisions are then made in each access point. Tumescent Anesthesia, which is a diluted form of local anesthetic, is then introduced through these tiny access ports using a blunt cannula. The Tumescent Anesthesia helps numb up the patient further, reduce risk of bleeding because there's some epinephrine in there, and also to help us pre-dissect in the planes that we're working in. In this case, submental liposuction was first performed to reduce some of the fat, so the FaceTite device may work even better. The FaceTite device is then used through all 3 access ports in a fanning motion to help us reach our target temperature. The 3 tiny incisions are then closed using sutures when we're finished. A compressive head wrap is placed and worn for the first night. The very next day, we remove the head wrap and exchange it for a much smaller facial sling.